Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are joined by Dr. Clay Marsh, Chancellor and Executive Dean for Health Sciences at West Virginia University, a national thought leader in health transformation. And Dr. Marsh is helping to truly redefine what it means to be healthy, not just free from disease, but through data-driven, science-backed approaches. So we are diving deeper into his keynote insights and exploring the future of cardiovascular health, tying this together and making it all make sense as best we can. So you have really talked about redefining health, and it's not just looking at cholesterol and blood pressure. Can you explain what those indicators would be if you were really looking at the complete self and how to measure someone's health?
Well, thank you for that question. And what we understand is that looking at some of the standard definitions of health, which really are quite hard to define, more balance between your physical and emotional and spiritual and financial, or the absence of disease, which doesn't really help us, that we believe that the best way to define health is to establish the difference between our birthday age, our chronological age, and our biological age or our body's age. And there are ways now that we can measure our body's biological age very specifically. And so the difference between our body's age and our birthday age becomes our health. The lower our biological age is versus our chronological age, the healthier we are. And the greater our biological age versus our chronological age, the less healthy we are. And that would be at every chronological age. So we can be old young, or we can be young old.
Yeah.
And we want to be young old.
Right, no doubt. So when you're looking at that, I mean, your belief truly, and the data does show, that even education, stress, toxic stress, all those things contribute to an increased biological age, but there's a way that we can kind of turn that around. So talk a little bit about that.
For sure, and that's what's so exciting about what we're learning, because when we look at a number of different studies, what we really find if we synthesize the results from those is we find that the strength of our relationships and the communities that we feel that we belong in becomes the single most important driver of long and good life. The second most important driver is around our maintenance of purpose, the fact that we stay connected, we have a reason to get up in the morning. And then the third area that we have lots of control over is how we see the world. The more we see the world as a place, an adventure that we're on, we're in an amusement park, we're living this great story, with ups and downs and twists and turns, but these are just parts of an exciting story versus these twists and turns and ups and downs are here to punish us or to make us, fearful or to take things away from us. And so the more we can prepare ourselves for a great life of one where we feel like that we are able to overcome the obstacles that are put before us, which is what I believe education does, and then the connection and the purpose that most of us experience during a good part of our life relates to our job. So having education to a great job to a great community and purpose, and then looking at life in a positive way where we feel lucky to be alive and grateful, I think are really key secrets to living the longest and the best lives.
And one thing that you talked about is the data that really drives your thought process. So delve into that a little bit, the data that really supports what you just expressed.
Well, there's a number. So if we would believe that your health quantified is the relationship between your biological age and your chronological age, there's a number of studies that look at accelerated biological aging. And those studies vary from the Adverse Childhood Experience Survey, which was done now many years ago by the Kaiser Family Foundation, where they tested 17,000 people that were in the Kaiser insurance plan, and they looked at childhood traumas that occurred before people were 18. And they basically then scored each one of these traumas. There was 10 on the list, and they found that if you had 4 traumas, your risk of suicide went up by 1,200% and your lifespan went down by 4.7 years. And if you had 6 traumas that you remembered that were unresolved since childhood, then your lifespan had a risk of going down by 20 years. We also found that in a study from San Francisco from a Nobel Prize winner, that if you were a woman, average age 38 years old, and these 2/3 of these women had sick, ill children, and 1/3 had normal, healthy children. But they found, and the question of the study was, would the caregiving from the moms of the sick kids cause them to age faster than the moms of healthy kids? And what they found was that it was less important whether the mom's kids were healthy or not healthy. It was more important how the moms saw the world. So the moms that saw the world as the most stressful versus the moms that saw the world as the least stressful, whether they had sick kids or not, age faster. And again, the average age of women in this study was 38 years old. These were all San Francisco women, highly educated, good standard of living. But they found the life difference, the biological difference of the women with high stress scores was 9 to 17 years greater biologically than the women who had the lowest stress scores. And so it just tells us that the opportunities we have are to see things positively and to continue to stay connected and explore the world through the eyes of gratitude and optimism.
Let me ask you, because we all know someone, and we're like, gosh, they're so resilient. They look at things differently. They see the world differently. And then you have your friend who's just always like, oh, it's just horrible. I woke up. How was your day? It was okay. Well, what happened? They're like, nothing. But it was just okay. Yeah. You know, and so are we born this way? Are we trained this way? Our experiences, like you just compared, you know, 2 women who have had the same experience, but one can view it differently than the other. Where does that come from?
Yeah. Well, I love the quote by Anna Isnin, who said, we don't see things as they are, we see them as we are. And ultimately, I think we all see the world a bit differently. And part of that is the lovely diversity that we can experience when we have a group of people that we know, each with a bit of a different take on things. But I think when you look, and you mentioned the word toxic stress, I think when you look at that, I think that's a lot conditioning. When we look at what's happened in our country and looking at lifespan and looking at some of one of the other pieces of data I touched on was that we know today in the world, then there's the biggest gap that's ever existed between how long we live and how well we live. There's a 9.6-year difference in our lifespan versus our health span. The U.S. leads the world with this in a bad way at 12.4 years. So I think that we're so conditioned in our country to compete and want to be, you know, the influencer on Twitter, or we want to have the biggest job or the biggest house or the biggest car or whatever it is, celebrity. And the more we see ourselves having to compete in a world which gives us a very finite view of the world, the more we get anxious and we feel threatened, and our life is about having to get more and more and more and more, versus the other side of the coin is if we feel happy and satisfied with the fact, as we talked about, that we are each miracles. The likelihood any one of us will be born as us is 1 in 10 to the 2,685,000th power, which is impossible.
Right.
And so we are all miracles, and we're all connected, and we talked about that a little bit too. And if we see our lives as blessed, no matter how much money, what kind of job, then generally we're going to live longer and better. And that's really true of the blue zone areas of the world where people live long and well. These people never meant to live long and well. They just lived their normal lives with people they loved. And eat good food and exercise because they play, they have fun. And so for us, we're trying to learn from them, but maybe it's not just our attitudes or belief. Maybe it's the environment we live in and the social context that we are exposed to through social media and other, feeds that we get every day that cause us to feel threatened and to feel unsafe.
And I want to delve into that because I don't know that we're moving in a direction that even allows for that autonomous thinking. We're tied to social media. We know exactly what our friend is doing. They just got a new car, they just got a new job, the kids are perfect, and then you're looking at yourself and you feel the opposite. I guess it's a decision to push in the direction of having this health, because certainly the world is not promoting that type of lifestyle.
Yeah, I agree with that. I think the other part that's really important to recognize and to remember is because back in the day that we were trying to evade the saber-toothed tiger or whatever predator, then we became very, very focused at survival. And so our threat response is really very fine-tuned. And now we don't have the same threats. Our threat response remains from what it was. So now instead of the saber-toothed tiger, we're then focusing on the friend you mentioned in the social media feed that are perfect, that makes us feel less good. The way that our systems are set up, we are twice as responsive to threat or negative as we are to positive. So anything positive will start to pale when we get negative or threatening messages. And so if you look at the way that, social media platforms, advertising campaigns are done, they're generally negative because that strikes that part of us that's really always sensitive to that, and that's called aversion bias. So our aversion bias, which means that we respond to negative twice as strongly as we respond to positive, we're getting absolutely showered with that every day. And the way to avoid that is to get in wherever your good place is, where you understand that for the person on the social media feed, their life probably isn't as good as it looks. But even if it is, good for them.
Right.
We don't want to compare ourselves to others. We want to compare ourselves to being the best us we can be. And to me, that means less to do, more to be, more enjoying the people that we love and the communities we love. The privilege of service is really under-recognized as a driver of fulfillment and joy. The Dalai Lama said the two ways he believes that are important to fulfillment and joy are the recognition of the deep interconnection between all people and all things, and number two, service to others. And so I think that mindset, which is back when we were a developing country, we did all the time, maybe some lessons we can get from the blue zones and other areas of the world where people do live happily, where it's not about us competing with, our neighbors, but it's with us embracing and loving each other.
I love it. Just listening to you talk, I think about even our conversations. We tend to have long conversations about negative things. As soon as it goes positive, everyone's like, all right, well, we'll see you later. Those are shorter conversations.
Right.
We need to switch that. Let me kind of time this back into talking about cardiovascular health.
Sure,
so as we talk about heart disease, the number one killer still, after all of these years, do you really think this is the key to getting a handle on heart disease and stroke and all those issues?
I think that if we indeed are a population who is aging rapidly biologically, then it's natural to think that we would suffer more chronic level diseases over time than if we were the opposite. So if our body's age was low while our birthday age was high, we would have much more resilience in our body and our system than if it was the opposite. And the one finding in a number of these research studies that I reviewed is that the more your body ages biologically, the more likely you are to be overweight or obese. And when you look at, I'm in West Virginia, which is the greatest of all the states, state where it comes to overweight plus obese, Mississippi most obese, West Virginia most overweight. If you combine the two, we beat Mississippi. So I think that that having an obese population, and the U.S. is the 10th most obese population in the world, I think that's a marker for accelerated biological aging. And in all these studies, the more of these stresses, these negative responses you get from perceiving the world, the more you're likely not only to have a shortened lifespan, but to have more earlier and more chronic diseases, including cardiovascular disease. And I would say for one thing from a non-cardiologist, I think what's really been cool is looking at the impact of CPR and public health and drugs like statins. I mean, although heart disease is still the leading killer of people in the country, the mortality rate's been going down, at least on a lot of these, which shows you the success of combining great public health, great science and investigators, along with great care models that reach out into the community.
Yeah, you need it all. Yeah, no doubt. And I guess tying this into our physicians and healthcare systems who are listening, would you suggest, of course, getting all the checks? You know, you have to keep a handle on what's happening in the body, but then also to ask these other questions. You know, what's your outlook on life? You know, who's your support system? You know, how often are you walking? You know, asking all these questions to get that complete picture.
Absolutely, but I think it may even go deeper than that because, you know, there's a famous quote by Francis Peabody in the 1920s. He was at Harvard addressing a group of people, and he said the secret in the care of the patient is caring about the patient. And I think in healthcare and as a physician, and Jerry Blackwell being one of my early mentors, who is the president of MedAxiom, somebody who I love dearly, but we used to talk about the art of medicine. And the art of medicine is not technical, it's the connection that we have to each other. And I think it's giving a bit of yourself to somebody else. And in a world where you're now focused on metrics and outcomes and turnover and, you know, and you're measured on a lot of assembly line kind of level parameters, then people get burned out. People aren't engaged in the same way. There's a great book by a guy named Dan Pink called Drive, and says what motivates cognitive workers and what motivates assembly line workers are different. If you pay cognitive workers more to do a better job each time, they do their job less well because they work for autonomy, mastery, and purpose. And so I think part of what we need to do is we need to get the art back into the care provision. At the individual physician level or at the individual, you know, group level, I think everybody generally does that, but it's become very challenging with billing and documentation. Now maybe with some of the ambient AI, you know, solutions will be better, but I think that we have to be able to not just help our patients, we have to help our providers. And if we don't help our providers be the best person they can be and the best professional they can be, I think it's harder to expect the patients, the people that need their help, will get the absolute best part of them, because that really is a personal connection that we have. So again, I think the connection, the community, and you know, community, the root word of community means together in service, which I love. And the root word of health and heal and holy and holistic means whole, W-H-O-L-E, all together. So I think we have to come together. I think we want to help people live the greatest life. But I think if you compare, you know, staying deeply connected and staying totally positive and purposeful versus anything else, those are the three things that I think we really want to reinforce more and more and support, because for a lot of people, they just don't feel it. If you don't feel it, you know, you're not going to experience it.
Yeah, all right. For the patient and for the physician
Absolutely.
As well. All right, Dr. Clay Marsh, thank you so much. So much to think about and something we can all apply in our lives to be healthier.